You should always alert your doctor if you're overwhelmed or struggling to take your medications. We have lots of different options, and if one treatment regimen is not working for you, we can try something else. Ultimately, we want to know if you're going to be able to take your medicines properly, because if you can't, that's going to impact your blood sugar control. So if you have trouble remembering to take your medicines at particular times, you can set an alarm for yourself. You can use a medication diary. You can also use a pill box. If you're having trouble remembering how to take your medicines, it's important to familiarize yourself on a regular basis. You should read the prescription labels. In addition, you can write them down on your medication diary. If your medication is causing low blood sugar or hypoglycemia, it's important to alert your doctor. They will make sure first and foremost that you're aware of symptoms of low blood sugar and how to safely treat it. In addition, your medication may need to be modified. The dose may need to be reduced, or they may give you more instructions about how to take your medicines if you're not eating as much in that moment. Insulin delivery has come a long way. It's rare that patients would need to use a vial and a syringe. Most insulins are now available in pen form, pre-filled, and so very easy to use. And the needle used to administer the insulin is short and thin. Most people have no trouble at all. If you're on many insulin injections a day, you can also discuss consideration of an insulin pump with your doctor. And in some cases, we can actually use inhaled insulin in place of mealtime insulin as well. If you're feeling ambivalent about your diabetes diagnosis or whether or not you should take your medicines, it's really important to listen to your diabetes team, because even if you don't feel well in the moment, if your diabetes is mild or moderate, elevated blood sugars, even modestly elevated for long periods of time, can lead to significant health consequences. You can develop diabetes in the eyes, diabetic kidney disease, neuropathy or nerve damage, as well as increase your risks of vascular disease. If your treatment plan isn't working for you because you're not tolerating the medicines, it's too expensive for you, it's causing low blood sugar, it's really important to alert your doctor. Fortunately, there are a lot of different therapeutic options for diabetes. And so if one thing's not working, we can work together and find something that will.